Great Slave.
Thank you, Mr. Speaker. Mr. Speaker, echoing my colleagues yesterday, and once more, I'd like to talk about same-day health services, including lab services in Yellowknife. Far and away, the most concerns I hear as an MLA are about trying to get same-day appointments, either for lab or for speaking with a health professional. There are a lot of threads to pull on with this persistent problem, and I have gone back and forth with the minister many times as she and her staff continue to work through technical and procedural barriers to ensure fair and equitable access to health care for the residents of Yellowknife. Importantly, Mr. Speaker, I'm concerned for residents who, as of right now, depending on the random volume of patients on any given day, often need to line up outside the downtown primary care center for same-day lab appointments. Right now, it seems that we will be asking our elders, folks with disabilities, and those in chronic pain to queue in the dark, cold winter weather outside the lab for an hour until staff arrive to let them in just before 8. This is not a viable, compassionate solution. Mr. Speaker, I know that the crux of this ongoing issue boils down to a couple of key factors. The availability of appointments relies on the number of lab staff on shift. And we are seeing more people seeking lab tests, while there are fewer staff available to provide services since COVID. Mr. Speaker, I would also contend that sometimes miracles do happen. I had the unique experience this past summer of attending a scheduled test at Liwagoti. As I was leaving, I asked the admin staff if I could book another appointment down the line for other concerns. To my surprise, they said, "How about now?" I was seen immediately by a nurse who addressed all my concerns and did blood draws on the spot because seemingly, at random, I was present at a time when no one had come to get a same-day appointment at the clinic that morning. The nurse and I had the time and space to get through my questions that I couldn't address from an earlier appointment. Mr. Speaker, I know that that was blind luck, but this also means that sometimes there is capacity, even if it's just in a blue moon. I want to know what is possible to triage those with urgent needs, especially for those who can't physically wait outside in the cold. I will have questions for the Minister of Health. Thank you, Mr. Speaker.
Thank you, member from Great Slave.